So, good morning, everybody. Welcome to Peterborough Public Health's webinar for summer day camp operators and providers. I'd first like to thank everyone for taking time out of their busy schedules to attend today's webinar. For the next hour or so, my colleague Janet Dawson and I will be walking you through the COVID-19 safety guidelines for summer day camp, the current regulations, and any public health measures to ensure your camps can operate as safely as possible this summer. My name is Claire Townsend, and I'm the day camp lead for the summer camps this summer. I'm also the school and childcare liaison for all things COVID. Janet Dawson is working with me in supporting day camps. She's also part of the enforcement team and the municipal sport and rec liaison. So, as I said before, a few housekeeping things. The webinar. Oh, I'm just getting a comment that I can't be heard. Can everybody else hear me?
I can hear you, no problem, Claire.
I can hear you, Claire.
I can hear as well.
Okay, sounds like most people can hear me. For that person who can't hear me, maybe try logging in and coming back again, then I'll keep going. Maybe Janet, I can leave it with you to see. So the webinar will be recorded and posted on our public health summer day camp webpage, which we have links to at the end of the slide. We have a lot of content to cover, but we hope we'll have time at the end to answer questions. Please wait to the end of the webinar to ask your questions or type them in the chat box and we'll get through them together. If we do run out of time, because we do have a lot of content and we don't answer the questions or we don't have the answer at our fingertips, rest assured that we will compile a list of the questions and we will get back to you when we send out the recordings. All right. So before we get started, I'd just like to respectively acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectively acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. We recognize also the unique history, culture, and traditions of the many Indigenous peoples with whom we share this time and space. We give thanks to the Métis, the Inuit, and the many other First Nations people for their contributions as we strengthen ties, serve their communities, and responsibly honor all of our relations. Okay, so for the not so fun part, the quick disclosure statements. So as you can see in the slides, this webinar is intended for any camps or businesses that are operating a day camp in the Peterborough Public Health catchment area this summer. The presentation has been prepared for and recorded based on information that is current as of this morning. As we all know, throughout this pandemic, things change hourly, daily, minutes even. And so just to be clear that the information we provide is current as of today and that is subject to change. And if that happens, we will notify you. It is general information for education only, does not constitute legal advice. Whenever we reference a page number or a table, it is referring to the provincial COVID-19 safety guidance for day camps, unless we state otherwise, and that all owners and operators of businesses and organizations are responsible to comply with the orders under the Reopening Act as well, or any other instructions provided by public health. And there may be situations where provincial rules or local public health rules vary in the level of restriction. And so in that case, compliance must meet the most restrictive measure in preventing COVID-19. Okay, so today, as I mentioned, you're here obviously for the day camp webinar, and we're just going to go over the brief overview of COVID-19 transmission, talk a little bit about the Ontario Reopening Plan and all the regulations under effect in that act, as well go over the summer day camp guidance document and all the public health measures to hopefully help you run a safe day camp operation this summer. And with that, I will pass it on to Janet, who will get started.
Great. Thank you so much, Claire. If we were in person, I would be holding up I don't know if you can see that. It's not exactly focusing, is it? My goodness. If we were in person, I'd be holding up my COVID-19 safety guidelines for day camps. It's got the dog-eared pages because I've looked through it so many times. So this is definitely going to be your go-to document. So if you don't have it out already, please pull it out, because that is the page numbers that we're often referencing throughout the presentation. But I want to start by just explaining COVID-19. I know we're 16, 17 months in, and I know we're all very familiar with COVID-19 now. This is very different than last year when we were trying to run this webinar. But the research is changing. It is always changing, because we're doing studies, and we're trying to learn different transmission as cases come to light. So there has been some recent changes on the evidence of how COVID-19 is transmitted. You may have probably picked up on this, because it did trigger a whole slew of changes in the regulation. So some of you are likely familiar now, if you're in the sport and rec sector, there's been a big change to 3-meter distancing. That was a big change, and that's because they started to do some evidence and review on different outbreak scenarios with regards to exercise and physical activity. So by and large, COVID-19 spreads through respiratory droplets, and it can spread through aerosols from an infected individual, but that's under certain conditions. So that's really when there's loud speaking, forceful exhalation, limited ventilation, crowded spaces, and it also depends on the viral load of the individual who's infected at the time. So it by and large is spread by droplet, which is large particles that would come out from the infected individual and drop. So we give that 2-meter distancing to protect from the droplet transmission. However, as I mentioned, research is showing that there's certain conditions that do create aerosols, and that's smaller particles that stay suspended in the air for a period of time. So that's where we need larger distancing for protection. And we're starting to see a 3-meter distancing rule come into play. So we know now that we used to operate under the 3 risk factors for COVID-19, which was close contact, closed spaces, and crowded places. But in recent evidence reviews from Public Health Ontario, they have now deemed prolonged exposure and forceful exhalation as 2 new risk factors. So now we're operating with the 5 risk factors. And this is also being driven by the new variants of concern that are circulating, in particular the Delta variant that we're starting to hear lots about. As of last week, it was 31% of cases in Ontario, and it is 50% more transmissible than some of the early variants that we saw last fall. Next slide, please. So we know a little bit about COVID-19, and now we need to talk about prevention of COVID-19. So this is really taking you back to your occupational health and safety roots, and it's really the hierarchy of controls model that we need to apply here. And that's that inverted triangle. So it requires a multi-layer approach. So we have all the levels in the hierarchy of controls model, and ideally, if you can't do elimination, which is completely eliminating the risk for the virus, which we've learned is work from home, that's eliminating that risk, then you need to have a multi-layer approach of all those levels in the triangle in order to have a very strong and robust prevention and protection method for your workers and for your campers. Next slide, please. So I think we've gotten used to many of the layers of prevention over the last 16, 17 months. It's really making sure that we have multiple things in place to prevent, and we've definitely become accustomed to the word physical distancing of 2 meters, but again, now recognizing the 3 meters is now in play for some physical activity, and singing, and any other activity that would cause forceful exhalation or deep breathing. We've almost been about 10 months with mandatory masks and face coverings. We now see an increased need to protect our workers with personal protective equipment, which we will go over. Staying home if you're sick. We have screening tools in place now. Like, just think how far we've come over the last year. But we have screening tools to really make sure we have people staying home if they're not feeling well. Hand hygiene, we all know what sanitizer is now, and really improving our cleaning and disinfecting. cleaning and disinfecting and good hand hygiene is just your basic infection control principles. Minimizing contact, so we're going to get talking about that in this webinar, about the cohorting, creating the little bubbles for your day camps. Ventilation is key, and it is definitely a new emerging piece of research in this whole pandemic that we are learning about, and how increase in ventilation is important. And you can see that embedded in the Reopening Ontario Act plan, where they're allowing small outdoor things happening now, a little more outdoor things happening in step 2, and then moving to more indoor in step 3. But you can see that research is driving the reopening plan. And of course, another tool in our toolbox is getting vaccinated. It is a tool. It is not the be all and end all. It is definitely a tool, and the number of people that we can have vaccinated with 2 doses, it allows us to have a little bit more breathing room, but it will require we still have a multi-layered approach until the province and the federal government deems it safe to relax some of the measures. So we all familiar now, Ontario's reopening plan. It's now coined the Roadmap to Reopening. It was released in May. We joined step 1. We're now in step 1, and it is tied to provincial-wide vaccine indicators. It is also tied to provincial COVID-19 indicators. So a lot of people are saying, how come we're not moving to step 2? We've reached those vaccine targets provincially, but there are still we need to take into consideration hospital system capacity. Yes, we are way better than we were in April and May, which is wonderful for our hospital sector, but there's still a high concerning number in ICUs, and there's still death associated with COVID-19 cases taking place every day. We still have cases. We have these Delta hotspot areas in the province. So there's still good reason to tie to the 21 days before we move to each step. However, if the province moves us to step 2 earlier, they may. There's talk about it, but at this point in time, we are not tracking to go to step 2 until July 2nd. That is the earliest we could move to step 2. So this is the reopening plan. I will move to the next slide and we'll review. There's steps associated with there's new things that kind of reopen with each step. You can see in step 1, day camps is listed, but I just want to point out at the top, even though day camps are listed, it still says permitted with restrictions. So we'll walk you through what those restrictions are that the province has outlined. And to try to ensure that we open day camps for children, but we still keep the risk of transmission low. Okay, so the Ontario regulations. This is probably not the first thing that you want to read in a day. It is long and cumbersome, but it is really important because, if you will, this is the rule book for businesses and organizations that are open. So you have to comply with the orders enforced with the Reopening Act. So the Reopening Act and the Reopening Plan provides the high level of what is allowed to reopen when, but the nitty-gritty details of what actually can take place for the reopening is in the regulations. So step 1 is being guided by Ontario Regulation 8220. In fact, 8220 was also the regulation that was guiding the shutdown that we were in before step 1. But if you go down, schedules 1, 2, 3, 4, 5 are shut down, which are no longer in effect. But 6 to 10, schedule 6 to 10 are the regulations, is the requirements that are open right now, dictating the step 1 of the reopening plan. We do not have the regulations for step 2. That means we do not have the nitty-gritty details of what step 2 really will mean, but we're anxiously awaiting them. I want to point out that there are general requirements in the regulations for each business. Every business that's open and operating, there are general requirements. And then if you go down, there's specific requirements by sector. So you have to be compliant with all the general requirements, and the specific requirements by sector. Now, the regulations do have a day camp section, but your activities that you do at the day camp will also be guided by some of those specific sector regulations. So we'll walk you through that right now because it is a bit of a tongue twister. So we'll try to make that a bit clearer for you. What's really important is that you still follow all applicable regulatory requirements for your business and organization, including the Occupational Health and Safety Act. So there may be situations where provincial rule and local public health rules vary in level of restriction. So there's the provincial orders that you must be compliant with, but each local medical officer of health has the ability to bring in stronger requirements. And so you have to make sure that your business and organization is in compliance with the most restrictive measure. We do locally in Peterborough Public Health Region, we do have some stricter measures in place. One particularly is an instruction for workplaces. So that's any business or organization that's open. It's a workplace, so it will apply to you. And I will review that on the next slide. We do have a public health orders page on our website. I've linked to it in the resources page at the back at the end of this presentation. Check it regularly. We use social media, we use press releases to release when we have orders. But I think in COVID fatigue, messages are getting lost. So check our orders page regularly to see if there's anything in play there that you. But we did release last week, before I think, the instructions for workplaces, and I will review that now. So we do have a letter of instruction in place for workplaces. It's a formal letter of instruction for Dr. Salvatierra for all workplaces, and it really is her requiring local workplaces for three main things. This is in the regulations, but she has wanted to make it very clear to workplaces that there's a requirement for this, and there could be associated charges if workplaces are not found to be compliant. So we will talk about this in the presentation, but just quickly, I'd highlight that the letter of instruction that is been put out for workplaces is that the employer must ensure that all staff are actively screened each day before they come to work. So that we'll talk about that in the slides. That you must set your workplace up to accommodate physical distancing. So that's 2 meters and between staff, unless there's instances with physical activity involved, and that's 3 meters. And then if you can't maintain that 2 meters. Oh, I'll just ask if everybody can mute their mic for it. That would be great.
They can't.
So, or maybe Claire, you might be able to do that.
For the studio.
So if an employee must be within 2 meters of any other person, that's where the workplace is required to provide their staff with personal protection.
Mm-hmm.
Okay, I think I got muted too, so that's okay. It's okay. So if an employee is required to be within 2 meters of any other person, you as the workplace need to provide your workers with personal protective equipment. So that will depend, the personal protective equipment required will depend on the risk assessment for the organization. But to protect against COVID-19 at a minimum, it will require a medical grade mask that's approved by Health Canada and eye protection. So we will talk about that in later slides, but that is the letter of instruction that we do have in effect today for all workplaces in Peterborough County City Health Unit area. Okay, so regulation in day camps. So again, following your safety guidelines, you will see that you can only operate in a manner that's consistent with the safety guidelines for COVID-19 for day camps. So this is your walking papers. This is what you need to follow. However, I just want to highlight, it says it throughout the document a few times, but you can never be so clear on this, is that if there's a conflict between this document and the orders enforced by the regulations, the Minister of Health or the Chief Medical Officer of Health, the legislation and the orders prevail. So that means we fall to the legislation is the most restrictive, not the safety guidance. You use this to set up your day camps, but the legislation really is the be all and end all if there's a conflict between the two. So there are a few instances of that. We'll highlight what they are for you in this presentation. All right, so hopefully that gives you the lay of the land on the regulations, and that gives you the, the background of what's driving all of this. So let's begin. We'll talk about the safety measures to have in place for day camps this summer. Okay, so there's lots of guidance documents to support your journey on setting up your day camp. First off, there's the safety guidelines. That's really going to be your toolbook to work through. We also have, and we will send this out with the recording for the webinar, so do not worry. But there is a pre-camp planning checklist. There's a daily camp operations checklist. Public Health Ontario has provided a recorded presentation on personal protective equipment for day camp operators and staff. So there's slides, there's a video. It'll be really key to use that for training of your staff. There's scenarios for day camp operators and staff that Public Health has put together, Public Health Ontario that is. So they've consolidated all sorts of scenarios from across the province, and they've put that in that video. And they also have slides. And we also have a dedicated summer camp webpage on our website, and where we're hosting all the resources there. So if you can't find the email where we send out the resources, it'll be on our website. So trying to provide as many resources as we can to support your safe operation of day camps this summer. So every business or organization open and operating must have a COVID-19 safety plan. That is right in the general requirements for the regulation. So you need to make sure that you have a plan in place where it is really your go-to document for all your COVID-19 protocols, procedures. This is a living document. COVID-19 regulations and rules are constantly changing. So this document will be your living document. If you haven't updated it since last year, that is a bit of a concern because things have changed with COVID. It changes monthly and weekly and sometimes daily. So the important part is that there is a copy of the plan. It can be a summary posted in a visible location for the public to see. You can have that on your website, and you can have it in a public location at your camp. The safety plan, as I mentioned, describes all those measures you're taking to reduce the risk of COVID-19 at the camp, and it has to cover off the measures for staff, the measures for campers, and the public if that's applicable. So let's think about this for a bit. It's really going to be your go-to COVID-19 operations manual. That really is. And there is a tool from the province that you can use. It covers off some good questions, but for day camps specifically, it might not cover all the questions that you need to think through. So really, think about how are you screening your staff, your camp participants, your essential visitors. What is the tools you're going to do to screen it? How will you ensure that you're having that attestation that the screening has been complete? How will you control the risk of transmission in your camps? What are your cohort numbers going to be like? You really documenting that in your safety plan. How will you ensure people keep 2 meters apart, 3 meters during physical activity? What are you going to do if there's a potential case? Who are you going to call? What is your communication methods with parents? How are you going to reach them on weekends? Those kinds of things all need to be documented in your COVID-19 safety plan, because really, when you think about it, if you're not at the camp and you have a leader or a supervisor at the camp, they should be able to go to the safety plan, pick it up, and know exactly what to do. That is the importance of the safety plan. I'm going to turn it over to Claire now, who will walk you through sessions and cohorts.
Great. Thank you, Janet. So Day camps, one of the main things is that day camps must run for a minimum of 1 week. So that's 5 consecutive days, and they must maintain consistent cohorts for the duration of those sessions. This is a very important distinction this year from last year, and the province has bolded this in the guidance document. This means you can't operate a camp for 2 or 3 days a week and be allowed to open as a camp. This is a preventative strategy to minimize families enrolling children in multiple camps throughout the week, resulting in lots of mixing of cohorts and increasing the risk of transmission. Keeping it to 1 week ensures more consistent cohorts. And wherever possible or practical, please consider grouping your participants who are members of other cohorts outside of camp. For example, the same household and siblings. If you can try and group those together. You also see on table 1 in page 5 that there's very clear staff to camper cohort ratios. This is a guideline for maximum ratios. And I highlight maximum because if your facility does not have the space to allow for adequate physical distancing between the campers and other cohorts, you should aim to reduce the number of campers in each cohort. So it really is contingent on the space that you have provided for you. This provides a guidance for maximum, but please take a look at your space you have to plan accordingly. Please note that detailed contact information for these cohorts, so any campers, any staff who are with them, must be available for public health to have in order to assist with any contact tracing in the event of a case or an outbreak should occur. In addition to the guidance provided in this document, you'll see where I've highlighted the arrow below, and as Janet's talked about, day camp programs must also comply with other applicable setting activity-specific requirements or restrictions to align with the ROA, such as sports inside. And Janet will speak in a little bit more detail about that later on, but I did want to highlight that again. So cohorts and physical distancing. So the main thing is that physical distancing of 2 meters or 3 meters for exercise or singing, and Janet and I are going to say that for this presentation that's going to be embedded in your head, remains one of the most effective prevention methods against COVID-19. Cohorts, so the campers and their assigned staff, must not mix with other cohorts. This includes pickup times, drop-offs, meal times, before and after care, playtime, any outdoor activities. You will need to ensure you have created plans and have a clear process for all of these times to prevent the cohorts from mixing. So the coming goings into washrooms, into where they're going to be eating their meals. You need to have a plan out and the staff need to be educated on that. Programs that use indoor room or space that is shared by other cohorts, for example, in tents or gymnasiums or hallways, or if they have other groups in those, for example, if you're sharing, if you're in a community center or a museum and you're sharing that space with other groups, the room or space has to be cleaned and disinfected before and after each use. And it is recommended that there's a log posted and it's used to record this cleaning so that everyone is aware. And each cohort of camp participants should have their own assigned indoor space separated from all other groups. If possible, use visual cues or physical barriers that don't interfere with the airflow or pose a safety or fire hazard, such as floor markings or cones or pylons, to reinforce the physical distancing requirements between groups. We know that kids can get excited and they can, see a friend in another cohort and want to jump over there to say hi, but we really want to give them all the tools and provide all the cues to stay within their cohort. So play structures, so outdoor play structures can only be used by one cohort at a time, and hand hygiene should be performed before and after use. It is important that camp staff always have hand sanitizer readily available for this. Plans should be made to prevent the mixing of cohorts in washrooms and change rooms. Signage should indicate maximum capacity, and a cleaning log should be recording here as well. In shared outdoor spaces, cohorts must maintain a distance of at least 2 meters or 3 meters if doing physical activity or singing between groups and any other individuals outside of that cohort. So there are 2 types of requirements for screening, as outlined in the guidance document: passive and active. First, for passive screening, operators must ensure that they post screening signs at all entrances to the camp in a location that's visible to the public. The screening signage must follow the Ministry of Health recommended questions, and we do have up-to-date posters available on our website that you can print and download and post. And we do, as things change and as the questions change, we update those. So please refer to our website for the most recent information. In addition to passive screening, camp operators are required to actively screen every camp staff, camper, and visitor for COVID-19 symptoms every day. Where possible, daily screening of camp participants should be completed electronically by a parent or guardian prior to arrival to camp. And the prior is key in that if they have symptoms, we don't want them showing up at camp. So please encourage prior to arrival screening every day. Day camps may use the COVID-19 school and childcare screening tool, which is available online, or a similar process. If you want to create your own, you can create your own form or your survey or something to be emailed in advance. But the questions on your survey must align with the provincial tool. And day camp operators should keep records of each camp participant for whom screening has been completed. Each entry must be denied to any individual who does not pass the screening for COVID-19 symptoms. Excuse me. Some of you may already be familiar with the screening tool if you have kids that were in school or childcare. And you also would have had to complete it if you have jobs elsewhere. However, if not, please go online and try running through it as a camper or as a staff. You can go through it and go through different scenarios to see what the directions are. It is important to note that this tool is updated periodically, and I will share those updates with you so that you are aware and that you can align your own tool if you have one so that it has the same questions. The most recent update to the screening tool happened so that it now reflects post-vaccination symptoms in that you can now come to camp if the camper or staff or anyone in their household has COVID-19 symptoms after receiving the vaccine within the last 48 hours. So there's 4 specific symptoms: headache, fatigue, muscle aches, joints and pains, that if they have those and they've received the vaccine within the last 48 hours, that they can attend camp. Otherwise, the general rule is if anyone in the household must stay home, if anyone in the household must stay home if anyone has COVID-19 related symptoms or is waiting a test result, and they must stay home until they either receive the negative result or cleared by public health or receive another diagnosis from a healthcare professional. So the use of non-medical masks. There are different requirements for campers and camp staff in regards to the use of masks and personal protective equipment. All camp participants in grades 1 as of this September and older are required to wear a well-fitting non-medical mask while inside. Campers are not required to wear a mask for outdoor camp activities if physical distancing of 2 meters or 3 meters if singing or physical activity is taking place can be maintained between camp participants and other cohorts. Camp staff should make sure to plan activities where campers can adequately be spaced. Parents, guardians, and visitors are required to wear non-medical masks in any indoor area of the camp. They are not required to wear a mask outdoors, but should be encouraged to anytime 2 meters of physical distancing is not possible. For example, during drop-off and pickups. Of course, there are reasonable exceptions to wearing a mask, and it is not provincial requirements, nor is it encouraged to obtain a doctor's note for medical exemptions. So employers must follow the requirements under the Occupation Health and Safety Act and take every reasonable precaution to protect the health and safety of workers, including preventing them from hazards posed by infectious disease such as COVID-19. All staff in a day camp setting must wear a medical grade mask with reasonable exceptions for medical conditions. All day camp staff must wear the medical grade mask and eye protection, for example, a face shield, safety glasses, or goggles when unable to maintain physical distances of at least 2 meters or 3 meters during physical activity or singing when engaging with an individual who does not have a mask on or cannot wear a mask. The use of masks by staff during outdoor camp activities is encouraged and required, again, if they can't maintain the physical distancing. Staff may take off their masks, staff may take off their masks and eye protection when eating or drinking or on break, because we do encourage staff breaks for staff as well as campers. However, time off with masks should be limited and a physical distance of at least 2 meters should be maintained between all staff members when they're not masked. A training program for the recommended precautions, including PPE, should be provided to all staff and essential visitors. For example, a generalized infection prevention and control training is available that Janet talked about earlier, and the links are in our resources. So please make sure your staff are well trained on how to don and doff and care for PPE. So in short, if you can take anything away, the use of PPE by camp staff, so medical masks and eye protection, applies indoors and outdoors whenever 2 meters or 3 meters if you're singing or engaging in physical activity cannot be maintained. So camp operators and providers are to ensure that cleaning protocols are in place to minimize transmission. Frequently touched surfaces, for example, doorknobs, light switches, handrails, paddles, should be cleaned and disinfected twice daily at a minimum. More frequent cleaning and disinfection may be necessary if items are visibly dirty. Hands should always be washed after cleaning. Sharing and frequency of touched objects, toys, and equipment and surfaces and other personal items should be minimized. Ensuring that toys and equipment are made of material that can be cleaned and disinfected, example, avoiding plush toys and Play-Doh, is important. If they cannot be cleaned, then ensure that they are single use and are disposed of at the end of the day, example, certain craft supplies. Campers should be discouraged from bringing personal items to camp, for example, their favorite stuffed animal, because you can't ensure that they can be kept clean. Disinfectants must have a drug identification number, or a DIN. It is an 8-digit number given by Health Canada that confirms its approved use in Canada. Use Health Canada's list. We have the link on the website, on the resource page, to choose products that are approved. I want to note that household bleach does not have a DIN, but however, it is an effective disinfectant when it is diluted properly. And we have the dilution ratio also in a resource at the end. Along with physical distancing, hand hygiene is another important preventative strategy to reduce transmission. All camp staff and campers should be trained and instructed on proper hand washing and sanitizing techniques. Oftentimes, it's helpful to post signage in the washrooms or at hand washing stations as a reminder. Camps need to make sure that staff and campers have access to hand washing stations and supplies and hand sanitizer with a minimum of 60% alcohol. For the younger campers, staff should supervise hand sanitizing. So if you have to leave the premise for an activity or a field trip, we recommend that you choose destinations. So example, if you're going to a park or a playground or a splash pad, that they are within walking or biking distance for your cohort. If you have to use transportation, it must be a chartered bus and limited to that single existing cohort of day campers. Public transportation is discouraged due to the increased risk of potential exposure to COVID-19. If avoiding public transportation is not possible for essential camp activities, there are guidelines to follow, and I refer you to page 8 in the guidance document to see those. So snack breaks and lunchtime are important to ensure that campers and staff are refueled and energized for the day's activities. Campers and staff must clean their hands before and after eating, and please make sure that your camp staff, again, have hand sanitizer readily available for this, as well as playing on equipment. Masks can be removed once they're seated and their 2 meters of physical distancing is maintained between each camper. Each camper should have their own individual meal and water bottle with no common food. It is important to reinforce that there will be no sharing food policies, okay? Make sure that campers and staff have access to drinking water throughout the day, as it's important, and we all know it gets hot. So I know a lot of times when they have the mask on, or they're not sure about, taking it off to take a drink, please encourage that we still are wanting them to have water throughout the day. So we encourage campers to take frequent water breaks. Water fountains are for refilling personal water bottles and disposable cups only. Campers and staff should not drink directly from the spout. If staff will be giving out any food items, they must clean their hands prior, use tongs if possible, and wear gloves. I will now pass it back to Janet, who will review some of the other activities permitted during the camp day.
Great. Okay, so you've got all your list of preventative tools in your toolbox, and now you're trying to figure out what you can do at your camp. So we need to look at page 5 of the guidance document for the very bolded statement that said that day camp programs and outdoor education centers must also comply with applicable setting and activity-specific requirements, as well as the general requirements in accordance with the regulations under the Reopening Ontario Act. So that's getting back to where I said previously that you will use the guidance document to set up your day camp, but what you're permitted to do at the day camp falls to the regulations. So we really need to dissect that a little bit to understand what is permitted for you, and what is permitted in step 2 may change for step 3. It definitely will change from step 1 to 2, but we can share with you what we know right now around step 1. And we'll revisit this and send communication once we have the step 2 regulations. So if we look at the regulations, we need to first understand the indoor versus outdoor. That is critical. So obviously, day camps are a permitted reason that can be inside a sport and rec area, a sport and rec facility. They can be inside a meeting and event facility. They can be inside in a community center right now. That is a permitted reason for something to be happening in those facilities right now. But just because it's allowed to go indoors doesn't mean the activity, the sport and rec activity, can happen. So that means you'll need to go outdoors. And we have received lots of questions about what constitutes an outdoor setting. So obviously the safest option is completely outdoors, no enclosed area, lots of fresh air, lots of ventilation. I know many of you are trying to put plans in place for being outdoors, but still providing a little bit of cover and protection. So if the camp will be in an area that, or the campers are in an area that's covered by a roof, a canopy, a tent, an awning, or any other overhang, you must ensure, and this is stated clearly in the regulations, that at least 2 full sides of the entire area must be open to the outdoors and must not be substantially blocked by any wall or any other impermeable barrier. So if you are using tents, you will be erecting tents outdoors to provide a little protection from the elements because your camp is going to be operating outdoors. You must ensure that 2 full walls are open in order to be considered outdoors. But I just want to highlight the safest option is completely outdoors so that we can just let the natural ventilation flow through. So lots of questions around recreational activities and sports. So as I mentioned, sports and rec facilities are permitted to open for day camps. So you can go inside. The day camp can operate inside the sport and rec facility, but you are not allowed, according to provincial regulations, to do sport and rec activities indoors until step 3. And we still don't even have the step 3 regulations, so we don't know what that's going to look like yet. So if you're running camps starting at the beginning of summer, we will be pivoting and working with you to figure out the step 3 regulations once they're released. But for now, we know from the provincial reopening plan that sports and rec activities are not allowed indoors in step 1 and 2. So that means that if you are operating out of a community center, the indoor area will really be that space where you can come inside, distance everybody, get with their masks on, give instructions for the day. You could have your meal breaks in there, but most of your programming will need to be outdoors, particularly for step 1 and step 2. So if you're going to offer sports and recreation programming, you need to make sure that for step 1, we have the regulations for step 1, so I can tell you it needs to be outdoors. You need to be in groups of 10 or less. So I know that's there's a disconnect there with your cohorting sizes. So that will mean, though, to be compliant with the regulations as per page 5, you need to break even into smaller groups and distance everybody 3 meters to be compliant with the regulations. And again, everybody needs to be distanced by 3 meters. So that's roughly like a pool noodle and a half. So showing kids visual of what 3 meters really is, I think will be very important so that everybody can keep that and maintain that during the physical activity. As I mentioned, there's a little bit more sports and rec allowed in step 2, but as we can see from the reopening plan, it's completely outdoors. No indoor sport and rec activities can take place until step 3. And even then, we don't have the regulations from the province yet, so we can't really tell you what the specifics are for those activities in step 2 and step 3, but we absolutely will release that information once it becomes available. We have received a lot of questions about what activities meet the definition of sports and rec. And we really need to encourage you to use the 5 risk factors that we reviewed at the beginning of the presentation as your guiding principles to conduct your risk assessments. Close contact, closed spaces, crowded places, prolonged exposure, and forceful exhalation. Those are the 5 risk factors, and you definitely don't want to check multiple boxes. The last one, really, forceful exhalation, is really at the nexus of physical activity and exercise. Anytime any activity is increasing the heart rate or the respiratory rate, it will lead to deeper breathing, it'll lead to forceful exhalation. This means if you're inside and you're doing an activity that will cause forceful exhalation or deep breathing, it will not be permitted. Even yoga is designed to foster deep breathing, which means it would not meet the regulation, and it needs to be done outdoors with 3 meters distancing. Just remember, this is for your safety and prevention. We want to set it up as safe as possible. We do not want to have any cases for you. We're trying to help you run safely your day camps all summer long. So just remember, use those 5 principles as your guiding tools. The more boxes you check for an activity, then that means the higher the risk, and do not proceed, modify it, take it outdoors. Okay, so other popular day camp activities, singing and chanting. Definitely, I have tons of memories of camp as a child with singing lots of camp songs. Unfortunately, there's no singing indoors. So the singing, as per the regulation, this is found in the teaching and instruction section of the regulation. It can only be done outside, and it must be separated by 3 meters. If you cannot separate by 3 meters, there is a section in this part of the regulation that says you can erect an impermeable barrier, and then you don't need the 3 meter separation outdoors. But if you can't get the impermeable barrier between your campers, then you need to be outdoors and distance 3 meters before there's any singing. Now, splash pads. If you're in town or in Norwood, there are some great splash pads around our county and city. So it does allow you to attend these community spaces. However, we just have to flag for you, it really is important for your cohort to remain intact. So if you attend the splash pad with your group and it is very busy, do not go with your cohort, because there's such an important requirement to keep your cohort intact and there's no mixing. Okay. So I'm just going to highlight a little bit about vaccination. So as I mentioned, vaccination is another tool in our toolbox. It is something that we need to encourage, particularly the 2 doses. So 1 dose provides some protection against COVID-19, but with some of the variants of concern that are circulating now, we're not seeing as much protection from the first dose. You really need the 2nd dose to provide the protection. So as an employer, I mean, vaccination, it reduces absenteeism, it creates a more productive workforce. So enabling your policies and protocols to allow staff to go and get vaccinated is definitely a great choice. But also encouraging your campers, if they are over 12, to be vaccinated as soon as possible, and ideally before they come to camp. So we're excited to say that there is going to be a family walk-in COVID vaccine clinic Saturday, June 26th. So that is this coming weekend from noon to 3 at the Evinrude Center. So we thought we would highlight this for you, because this may be something that you want to send out to people, particularly registered in those early July cohorts, that they may want to stop by this clinic. It is a walk-in clinic, so you need to bring your Ontario Health card and proof of residence of being in the Peterborough County City Health Unit, Peterborough Public Health catchment area. So there is information available on our website, and we've provided you that information there.
Great. And I'll take over for case and contact information. So just to lay the groundwork, it is critical that you as operators and day camp providers have a robust registration information and attendance sheets to help facilitate timely and efficient contact tracing in the event that there is exposure or a confirmed case of COVID-19 in your camp. This includes attendance records, cohort lists, before and after childcare lists, transportation lists, if you do any trips, and seating charts, as well as up-to-date contact information for parents, caregivers, and staff. This is important not only for contact tracing, but if you have an ill camper, you need to be able to contact the parent or guardian to be able to come and collect them as soon as possible throughout the day. So Peterborough Public Health will provide individual direction regarding testing and isolation of any close contacts to a case. And we will also determine the next steps for camp participants or staff who have been exposed to a confirmed case. It is the responsibility of Peterborough Public Health to make the determination of if and when there may be a COVID outbreak associated with a camp. If an outbreak is declared, PPH will provide camp operators direction on next steps, including outbreak control measures and ceasing operations if necessary. We will also advise when the outbreak is over and you can resume camp activities. So just most of the time, Peterborough Public Health will be notified of a positive case first and will begin a detailed investigation to determine high-risk contacts. If there is a case that is associated with your camp, we will contact you and ask for cohort and those transportation lists for the campers and staff, as well as their contact information. From there, we will advise on whether any cohorts may be impacted and the need to isolate or seek testing, and whether the camp can remain open or needs to close. We will facilitate issuing letters or calling the families impacted and provide directions on next steps in terms of this isolation or testing. We will also provide clearance for any campers or staff who are in isolation, and we will let them know when it's safe to return for camp. So that is not a decision that you have to make. Please rest assured that Peterborough Public Health will be following those cases and those contacts and will let them know when they can resume return to camp. And just to note that each case is unique and each of their situations and each context is very unique. And so this just provides a general outline of how the process will work. So rest assured that PPH will be very involved and we will contact you once we have notice of a positive case, and we will work with you and we work together to reach out to all those impacted cohorts. But each time it's different. So it's hard to give you a complete scenario, but just so you have an idea. So we all know that even with the best laid intentions and with pre-screening every day, that it is likely that at some point through the summer, you will have a camp participant or staff who will become ill while at camp. If a camper or staff becomes ill, they cannot continue to attend for that day. If anyone's experiencing symptoms while attending, they are to be immediately separated from their cohort and placed into a pre-established supervised isolation area where they can wait until their parents or guardians can come pick them up. Please ensure to keep 2 meters distance from any other person. And if the camper can tolerate it, provide them with a medical grade mask to wear, whether in this isolation space. For staff who will be attending to the symptomatic camper or another staff member who should become ill, they as well must keep the 2 meters distance and not recommend, but it's required that they wear the proper PPE. This will include medical grade mask and eye protection. Of course, if first aid is required, staff can come within 2 meters of a camper, as that takes priority. Having all of this information outlined in your COVID-19 safety plan, as Janet talked about earlier, and ensuring staff are adequately trained and aware of the procedures and the isolation room location will be very important to avoid unnecessary transmission. To ensure symptomatic campers and staff are separated from others, there should be a designated space or room for them to go. As well, camp should maintain a PPE kit specifically for dealing with campers or staff who become symptomatic throughout the day. The kit should be labeled and readily available for staff to use quickly if they're not already wearing the PPE. The kit should include items such as alcohol-based hand sanitizer, medical grade masks, and as I said, consider purchasing kid sizes, eye protection, so face shield or goggles, and any gloves to clean up any messes that may happen. So, sorry, I think I missed that one. But so when do you notify public health of symptomatic campers or staff? The answer is, in general, camps should not report all instances of illness in a staff or camp participant. We do not need to know every time you send a camper home with a runny nose. However, if as a camp operator, you are in the opinion that this may be a reportable disease, including COVID-19, then you are advised to contact Peterborough Public Health for specific advice on next steps. You can leave a detailed message at the number provided below, and you can leave all the information there, and it will be checked by a public health nurse. This line is monitored daily throughout the week, and someone will be in touch if they need follow-up. And I just want to make an important distinction, because the system's not perfect, and we all know that sometimes things can be missed. So if you as an operator, or if one of your camp staff become aware that a participant or a staff member has tested positive for COVID-19, please notify us immediately so that the investigation of exposures can begin. Sometimes if the individual's permanent address is outside of Peterborough region, it goes to the other health unit, and then there can be a delay on when it comes back to us, and a delay then in the investigation, and a delay in notifying the exposed or the impacted cohorts. So the quicker this information can be brought to our attention, the quicker we can investigate. So if you do become aware of a positive case, please let us know, and we can see whether or not it's already being followed and it's taken care of and there's nothing you need to do, or if we then have to start the investigation on our end. And on that note, and with 3 minutes left, oh dear, that brings us to the end of the webinar. I will open it up for more questions, and I see that there's been some chats, some comments happening in the chat box. And this was a lot of information. I understand that you may need time to digest, and you may have questions after it's been percolating for a while. So please feel free to reach out to Janet or myself, send us an email or give us a call, and we can answer any questions. We will try now, if people want to stay on for a few minutes, to go through one or two of the questions, and any of the other questions that we don't get to, we will compile a list and we'll send out a Q&A with the slides, so you have them all for your record. And the last couple of slides that there's lots of resources here. I won't spend a long time, but we have pages and pages of resources for you to help with your planning and operations. So on that note, with 2 minutes left, Janet, is there, you've been monitoring the chat, is there a question we want to? Okay.
Yeah, I've been monitoring the chat. So I was trying to answer as quickly as I could, if possible. We definitely had some questions clarifying the kinds of activities that can take place inside. We also have a question about group games. Again, I really have to highlight outdoors is safer. It is way safer to be outdoors for anything that you're doing, and it is to the protection of you, your staff, and your campers. So if you're questioning whether an activity meets the exercise or physical activity, my thought is, as soon as you question, take it outdoors. So there's that, and really think about those 5 risk factors. You are trying to keep those 5 risk factors to a minimum at all times. So at this point in time, there is no rules in the regulation about arts and crafts. So your arts and your crafts and your meal breaks could technically be indoors, but that distancing is critical. So they must have the 2 meters. At any point in time, any game or activity is increasing the heart rate. Duck, duck, goose, they're running around the circle, take it outside. So that's definitely been something that we're getting questions about. We did get questions about eye protection. So thank you so much for asking that. I did put in the chat box. I did put in the chat box that we have an FAQ for PPE on our website. Our resources page links you to numerous resources, but we do have an eye protection guidance document. So we did have some questions about eye protection, so I'll refer you to the eye protection guidance document. And just so you know, we will send out this recording as well as a PDF copy of our slides, so that you're able to click on the resources link and go right to that resource. And again, if we don't get to any questions today, we will absolutely answer them and email them out. Sorry, there was a question. What if campers are keeping masks on during those activities? No, they are not allowed in the regulations. They are prohibited. So those activities need to go outdoors and follow the guidance in the regulation. So any sports and rec activities, even if you can keep your mask on outside, are not allowed as per the regulation. Yes, good question about rainy days. So part of your safety plan needs to be that you have a rain day plan. Just because it's raining, it doesn't allow you to go indoors to do your camp program that includes sport and rec activities. So you will need a rain day plan, and you will need to think through the activities that you are doing. They need to be in compliant with the regulations. So a full day of indoor arts and crafts on a rainy day likely is not a good option. So maybe that's a day where you have a tent outdoors with 2 full sides open, so that you can spread out in a very large tent and do some things. Your COVID-19 safety plan will need to think through rain days. Okay. Oh, great. Kids keeping their masks on while outdoors. I might defer that to Claire because she was supporting schools this year that had the exact same question about how you track kids and their masks.
Yeah, that is a really good question. And it's hard because kids are going to come within, 2 meters of each other. It's inevitable. What we recommend is that kids come with multiple masks throughout the day, and that they have, because they're going to get soiled, they're going to get dirty, they're going to get damp. And so in your registration package, please encourage them to come with multiple masks. If they have a way to secure the masks on them or put them in their pocket, then that's fine. But you do run the risk of then the camper losing the mask throughout their activities. And so we always found we advise schools to, have a safe place, whether it's on their desk, but a little bit different for camps, it's in their backpack or at your home station, which is where the campers can come back and forth to. But of course, if they want to have it on them, that is fine. But just, I really would encourage you to send a communication around multiple masks coming to camp every day.
Okay, I think we've gotten through. Oh, great question. Is it recommended to wear masks while using the splash pad? Well, that's a great question, because if the mask gets wet or damp, it's not going to work. It's not providing the same kind of coverage. It may also droop. It goes below the nose, and then we're not covering the mucous membrane properly. So that will be something that you'll have to think through in your analysis and assessment of the activities. But I would really encourage you to go back to the 5 risk factors. If there's any other people at the splash pad, it's really not a good safe place for your cohort. You roll up to the splash pad. You're the only people there. The kids, make sure they take their masks off if they want to, and they can run around keeping their distance. The splash pad will be one that you will need to think through operationally. It definitely, you may, depending on the cohort numbers, you may want to keep a few kids back doing something at the side, and only 3 or 4 are in the splash pad. Create that space. It's really important to create that space. Yes. Thank you, Jacob. Definitely a reminder to wash masks after each day. Put that in your camp package. Okay, well, I think what we'll do is we'll close it off there. Does that feel okay, Claire?
Yep.
Was
That's
there another?
Uh,
Do they wear masks in canoes? Well, again, canoes, if you can't give the 3 meters distancing, it's not an activity you can do. So you need to make sure you can have 3 meters distancing. And if there can be 3 meters distancing at all times, then they can remove the mask. But again, totally recommended to wear one. It is that layer of protection. Okay.
Perfect. Thank you, everyone. So we will compile all these questions, and we will be sending the slides out and the recorded webinar by the end of the week. Thank you so much for your participation, and have a great day, and good luck with all your camps.
Thanks, everybody.